Hello, my name is Bob Sherrar. I am a physician and epidemiologist who has spent a lifetime working on public health issues. I am the current chair of the section on public health and preventive medicine for the College of Physicians of Philadelphia. I would like to welcome you to this webinar series on climate change and health in Philadelphia. I would also like to thank Dr. Marilyn Howarth and the members of the academic public health programs who put this wonderful series of presentations together. Climate change is one of the most important public health issues facing our worldwide community. This webinar series was put together because the public health community must know and understand the huge impact that climate change will have on human societies throughout the world. And we must work together to lessen its impact. Now, Philadelphia is blessed with a wealth of public health talent. There are 8 schools in the Philadelphia metropolitan area that offer training in public health and hundreds of students working on various public health degrees. The purpose of the section on public health and preventive medicine is to bring this vast public health community together to address issues facing our communities. Any person interested in public health may join the section, where they can network with the public health leaders of our community. You do not have to be a member of the College of Physicians. Student memberships are free. To learn more about the section, go to the college's website and read about the various activities that we sponsor. Now, sit back and relax and learn from these wonderful webinars. Thank you.
Hello, everyone. Welcome to Climate Change webinar. In this webinar, we are going to talk about extreme heat, air pollution, and adaptation strategies. Before we start our webinar, all the presenting authors do not have any conflict of interest. Thus, the presenters have no relevant financial or personal conflict of interest to this topic. And today, we are going to briefly talk about some introduction of this webinar, and climate change and heat exposure will be covered by myself from Temple University, and the climate change and air pollution will be covered by Dr. Kabindra Shakya from Villanova University. The purpose of this webinar is to provide you information to examine heat exposure in urban areas and also its related health effects and individual adaptation behaviors that can help reduce heat exposures. And also we will talk about how heat-related climate change can affect air pollution, especially in Philadelphia. The first speaker is myself, and I am an associate professor of environmental health in Department of Epidemiology and Biostatistics at Temple University. I also direct Exposure Science and Risk Assessment Laboratory. My current research includes characterization of the microplastics in air and food, and also characterizing indoor and outdoor air pollution, including heavy metals, dust, and organic chemical component. I also have several other projects in occupational health and safety. Of course, I do some the heat exposure studies and the disaster response research. Dr. Kabindra Shakya will cover climate change-related air pollution, especially in Philadelphia. He is currently an associate professor of environmental science at the Department of Geography and the Environment at Villanova University. He is also an associate editor, Journal of Environmental Studies and Sciences, and also editorial member of Sustainability Journal. His current research includes outdoor and indoor air pollution, especially particulate matter, ozone, and the nitrogen oxide. He also has expertise in trace metal contaminant, including the lead in soil samples from community gardens and residences and parks in Pennsylvania. He also interested in the environmental sustainability. Hello. As a first part of the webinar, I'm going to talk about extreme heat exposure and individual adaptation behaviors. My name is Inkyu Han. I'm an associate professor in the Department of Epidemiology and Biostatistics at the Barnett College of Public Health, Temple University. In this webinar, I'm going to briefly talk about extreme heat and the heat-related health effects and individual adaptation behaviors. And I'm going to present a case study, the association between heat exposure and adaptation behaviors in Philadelphia. And I will provide some summary of the study findings. First of all, there are many different ways to define extreme heat. However, there are major consensus include this extreme heat. So extreme heat is defined as extremely hot days, as days where the temperature equals or higher than 90 degrees in Fahrenheit or 32 degrees in Celsius. And heat waves is also defined as this term. The extremely hot days, especially the days where the temperature equals or exceeds to 95 degrees in Fahrenheit and or 35 degrees in Celsius. As you notice that the extreme heat and the heat waves, the definition of the temperature ranges is a little bit different. But in general, it's either 90 degrees in Fahrenheit or the 95 degrees in Fahrenheit. Especially for the heat waves, we are talking about the temperature, maximum daily temperature is greater than 95 degrees in Fahrenheit. And the extremely heat waves, it has increased a lot nowadays. And as you see on the left side of the picture, and you see the heat wave frequencies per year. In 1960s, it's usually about, in general, 2 days per year, and has gradually increased. And it is anticipated that it's in 2020s, the heat waves is approximately over 6 days per year. So approximately 3 times greater than 1960s. And not only for that, the heat wave duration has also increased. In 1960s, average length of the individual heat wave on average was about 3 days, but in 2020s is over 4 days. So that means over 30% increase from 1960s to 2020. And as an anecdotal evidence, in Philadelphia, we experienced several heat waves in the past 2 years. In 2024, first heat wave started June 21st. As you see here, the maximum daily temperature was about 95 degrees in Celsius, Fahrenheit. And those high heat lasted for 3 days, starting from Friday to Sunday. And the temperature is 98 degrees in Fahrenheit. And also in June 2020, last year, 2025, we also had a heat wave starting from June 22nd. Maximum daily temperature was 96 degrees in Fahrenheit. And actually those heat wave days lasted for 4 days. And then even the 5th days is below 95 degrees in Fahrenheit, but it's still hot. So it sounds like kind of nowadays we are experiencing heat waves like almost annually. And the heat waves started from June, not from the July or the August. And one of the reason of the heat waves and then also extreme heat is related to meteorological effect and also anthropogenic regions, such as like urban heat island, or we call it UHI. As you may know, that you heard about the urban heat island effects a lot, especially in the downtown areas. The ambient air temperature is greatly higher than the suburban areas or maybe in the rural areas. And as you see this graph, especially during the daytime, the ambient air temperature in the downtown area is about higher than the rural areas. And this high heat in the downtown areas is always higher, even at the nighttime, compared to the rural areas as well. And for example, it is estimated that the ambient air temperature in 90 degrees in Fahrenheit during the day may equivalent to 100 degrees in Fahrenheit on the rooftop. So it's very, very high. And also the atmospheric heat island effect, as I mentioned earlier, is always warmer in urban areas than the rural areas. And then also it is less intense than surface heat island. So surface heat island means the kind of surface of any building or even the road or the pavement and so on. As you saw a picture from previous slide, there is a temperature differences between the urban areas and the rural areas. And this slide gives you some overview of the quantifiable information of the temperature differences between the urban areas and the rural areas due to urban heat island effects. In general, the cities are 1 to 7 Fahrenheit hotter in the daytime. And at the nighttime, cities are generally 2 to 5 degrees in Fahrenheit warmer than the rural areas. However, some dense downtowns, such as like downtown of the Philadelphia or the New York City, especially the very highly developed the core areas, the temperatures in these locations can be 15 to 20 degrees in Fahrenheit hotter during the middays than the rural area because they have a lot of the surfaces. They cannot absorb the heat and they evaporate it. So what are the causes of urban heat island? So first, especially the urban areas, use a lot of the man-made materials, such as like the asphalt and then also the concrete and so on. So that actually they absorb and they generate a lot of the heat. And then also people like us create a lot of the heat production. So by using the vehicles and also heating, or maybe even using the air conditioners. And then also the urban landscape, because if we have the small area of the green space is actually good for the heat vaporization. But by removing the trees, we don't have any the heat evaporation mechanisms. So does the kind of the blue area, such as like river or the lake. And of course, the weather and the geography is one of the important factors as well. Now, I want to briefly talk about heat-related health effects. Heat is the deadliest weather-related cause of death, and it is expected to increase 4 to 8 times than in the 2010s. And then also extreme heat has caused almost 8,000 deaths and 40 to 64,000 hospitalization in 2010s. And then also extreme heat lead to other heat-related discomfort, and then the health symptoms such as like the heat exhaustion, trouble of sleeping, and then also problems with the thinking clearly, and sometimes even the birth defects. So although the heat exposure may not directly or rapidly causes a health effect, sometimes the heat exposure lingers for other adverse health effect. So in the recent report published by New York City last year, 2025, and the New York City estimated that total heat-related annual deaths is approximately 525. And then also they found that the heat stress deaths is about less than 10. And most of those heat-related deaths caused by heat exacerbated deaths. And the data is actually most of the heat deaths occurred in individual homes, especially the homes do not have the air conditioning. And the heat stress deaths are rare, as you see on the left side of this table. But the underlying conditions are exacerbated by the heat. So that's very important to know. And then also in the New York City, the Black residents die at twice the rate of the white residents. And in New York City, the urban heat island effects actually added almost 10 degrees Fahrenheit to city temperatures during the summertime. And what about the Philadelphia? So this is the Philadelphia Heat Vulnerability Index, prepared by the Philadelphia Department of Public Health. When you go to the Philadelphia Department of Public Health, you will be able to map out which community are vulnerable to heat during the summertime. And this location around the center area is the Temple University, where we are located. And as you see here, the southwest area of the communities are highly vulnerable to heat. And also northern Philadelphia are also highly vulnerable to the heat during the summertime. So in my study, I focused on heat vulnerability and then adaptation studies, especially in the northern the communities, because it's close to the Temple University, and see how the people are experience heat exposure during the summertime and how they adapt their individual behavior to mitigate heat exposures during the summertime. So the Philadelphia is one of the ideal location to conduct heat exposures and health effects because the extreme heat events are caused by the hot and the humid air from Gulf of Mexico or tropical Atlantic Ocean. And the Philadelphia is actually influenced by this hot and humid air from Gulf of Mexico and the tropical Atlantic Ocean. And Philadelphia also ranked the first for climate change impact among the northeastern states, and especially from extreme heat waves. And as you saw previous slide, we now experience the heat waves starting from June. And then also many of the Philadelphia residents are very vulnerable to heat because many are older adults, especially northern communities. And then almost a quarter of the Philadelphia residents live in poverty. And sometimes that they cannot afford ways to reduce heat exposure because of their economic constraint. And also nighttime heat exposure could be worse due to old housing built around 1945 or before 1945. So this data I pulled up from the Philadelphia airport. And I plotted the temperatures greater than 90 degrees Fahrenheit during the nighttime in Philadelphia. And then as you see here, the individual dot is actually showing the number of days, temperatures greater than 80 degrees in Fahrenheit during the nighttime. And the line shows the moving average over time trend. And as you see here in 1983, it's for approximately less than 5 days, showed the temperatures greater than 80 degrees in Fahrenheit. But in 2022, the days greater than 80 degrees in Fahrenheit is almost like over 15 days. So it is apparent that we see the increasing trend, especially the number of days greater than 80 degrees Fahrenheit during the nighttime. And so why nighttime indoor heat matters? First, many of the outdoor air temperatures are recorded at the weather stations, and many the health studies rely on outdoor air temperature as a proxy of individual heat exposures. However, this is not accurate because many people spend indoor rather than outdoor. And especially the approximately more than 80% of our time spent in indoor. So using the outdoor air temperature as a proxy of a heat exposure provide overview, but that's not a really accurate exposures in terms of the heat. And then also the nighttime indoor heat is very important, especially elderly population, because they do not move a lot throughout the day. And then also they are very vulnerable to heat. As you say, these elderly population or older adult usually have the underlying conditions. So they are very susceptible and vulnerable. So one of the way to mitigate heat exposure is adaptation behaviors that individual can take. In this webinar, I'm not talking about the adaptation strategies based on the city or the government, just focusing on the individual adaptation behavior. So individual adaptation behavior can be influenced by how individual perceive the risk. And the perceived risk is also associated with the nighttime indoor home exposures. And then individual attributes such as like age, gender, and other the demographics, and also the characteristics of the home environment and the community as well. So the nighttime indoor heat exposure we can say is as an external hazard. And the combination of the outdoor air temperature and the indoor bedroom temperatures, and then other attributes such as like home and community, the attributes such as like housing characteristics, whether have the AC or the location of the house, and then also community characteristics or the community characteristics, such as like kind of the infrastructures and so on. Of course, the individual attributes like the demographic factors, socioeconomic status, and the other things. And these the factors may affect personal heat risk perception, and then eventually this lead to how individual they change their behaviors to mitigate the heat exposures inside their home. So in our study, we recruited about 5 to 10 participants per each week. And the first day, we asked them to carry a small individual temperature sensors, and then put these individual sensors inside their bedroom or living room for 7 consecutive days. and then ask them to bring these sensors to us. And also we administer a questionnaire to collect individual information, the home and also community characteristics by administering survey. And during the summertime in 2024 and 2025, we conducted this study throughout the summer, starting from the June until the end of the September. Because we have a limited number of the samplers, and we are not able to conduct a study for entire summer for each individual. So each individual have the temperature, heat exposure measurement for 1 week. So from our study, so this is a very preliminary studies that we conducted in the north, the Philadelphia areas. And the average age of our study participant about 45 years old. And the most of them were either 30s or the 50s. And for the gender-wide, about 64% were female participant, and about less than 40% for male participant. And in our study location, the race and ethnicity, the African American were the majority, followed by Hispanic, and white and others. So this race and ethnicity classification based on the individual responses, we acknowledge that this Hispanic could be Hispanic white or Hispanic African American, but the individuals, especially those who answered as a Hispanic, they did not specify whether they consider themselves as a Hispanic white or the Hispanic African American. And in our study location, the home ownership is like most of them actually rent their current houses. So only less than 20% had their own house. And in this location, the home type is majority of them that lived in townhome or the row house. And then also approximately 1/3 of them also reported that they live in an apartment. Only 2 respondents said that they live in a single house. And we also asked them whether they had any underlying health conditions. And among 33 respondents, and the most of them said, especially about 30% of them said that they have high blood pressures or allergy issues and then asthma, and then followed by some obesities and the diabetes and some heart disease conditions. And among these many peoples, and actually there are many of them has multiple the symptoms. So as I mentioned earlier, 24 had at least one health symptoms out of 33. As you see here, these are individuals who answered they had underlying health symptoms. And then among 24 is actually 12 participants had at least 2 the health the symptoms. So it basically is like about 50% of those who already have some underlying health condition has multiple underlying health conditions. And we also asked them about whether they have had any of the following heat-related symptoms during our 1-week study period. And as you see this slide, 17 out of 33 responded that they had a headache related to heat exposures. And they also had hot, dry, and cold skins during our study monitoring period. And also they felt weakness of their body, and followed by some the feeling faint, and also some of them has also muscle the cramps. And not many of them, but 10 out of 33 or so told us that they had some trouble the breathing after they are exposed to heat. The similar way, so about 24 answered that they had some the health-related symptoms, and the 2 people they actually did not answer correctly. So then we removed those 2 respondents. And unlike the multiple underlying health symptoms, is actually that among 24 respondents who experienced heat-related health the symptoms, 22 had multiple the heat-related symptoms. So this is kind of very the severe. Okay, so and then also we measured indoor heat the temperatures as well. So as you see here, based from the 33 participants, we calculate the average temperatures across the 33 participants throughout the day over the 7 days. And the x-axis shows the time of the day from the midnight to 11 p.m. And we found that the highest heat exposure people experience at home is around 4 p.m. until like 7 p.m. Of course, even around like kind of 10 p.m., their heat exposure is still higher than the early morning as well. So this shows that especially the nighttime heat exposure in general is higher than the morning or even during the kind of around the lunchtime as well. So as the summary or the outline of this webinars, so we briefly reviewed the definition of the extreme heat and the heat waves, and then also the causes of the urban heat island effects, and briefly covered the health impacts and the mortality issues, and the indoor heat and the risk, and also the behaviors and some of their capacities as well. And I would like to thank the study participant and the New Kensington Community Development Corporations. And this study was supported by, in part, the Temple University grant in aid and P2 from the PRCCEH and the NIH R21 grant award. And thank you for your attention. If you have any questions, please feel free to contact me via email.
Hi, my name is Kabindra. I am an associate professor at the Department of Geography and Environment, and I'd like to thank Dr. Inkyu Han from Temple University for inviting me to give a presentation on this topic of the measurement of air pollution at Villanova. And we happen to measure during the impact of the Canadian wildfire. So since this is not the live, if you have any questions about my presentation, please feel free to email me at this address, kabindra.sakya@villanova.edu, or you can check me about my work in my website, ksakya.com as well. So wildfires from Canada continue to impact the Northeast and Midwest region. As you can see that less than a month ago, the picture that is taken from the Chicago showing the impact of the haze from the Canadian wildfire. And another picture is showing in the Detroit region is the same that is impacting. And the flights being canceled due to the smoke that is traveling from the Canadian region at the Boston airport. And our own Philadelphia also had the air quality concern a few weeks ago due to the Canadian wildfire. So Wildfire smoke contains large amount of pollutants that are emitted during the wildfires. Particulate matter is one of the main components that are emitted during the wildfire that can impact the local and the regional air quality as well. It impacts the public health in that region. And exposure of the wildfire smoke has been associated with several adverse health effects that's been documented and has been studied thoroughly. So wildfires are linked to the climate change. Due to the climate change, there is more drought incidents that is occurring, and that makes it ripe conditions for the wildfire to occur. And Canada is especially experiencing more wildfire events, as you can see in this graph, that actually in 2023 they had the largest number of the wildfire that occurred. Actually, the area of the wildfire that occurred, because the line stands for the area that is burned, and the bar is for the area burned, and the lines are the number of fires. And so they had the largest amount of the fires that occurred in 2023, and that's why we also saw the severe impact from that event. Extreme heat causes the wildfire, so as climate change makes it really wildfire incidents to be more frequent as the planet warms, and the hotter weather that makes it to become more frequent. The NASA's website says that fire weather is becoming more common, and human activities are the main cause. So the hotter weather, early melting of the winter snow, warmer nighttime temperatures, and decreasing rainfalls, these are all contributing to the increased fire activity in the region. So in the Western United States, you can see that the fire is getting more frequent, as we can see that in x-axis the year that is shown, and in the y-axis it shows the forest hectares that is burned, and these different digits shows in the different region of the Western region, which actually I haven't shown the map here. I want to show this the graph that was also published in the same paper in Holden et al. That shows that as we're getting more drought and less rainfall, and that actually leads to increase in the amount of the area where the wildfire occurs. When we had a more wet rainy days, then we see actually the less area that is burned. So it is directly related. This again shows to the climate change and the global warming. The air pollutants in the wildfire smoke, there are several kinds of the air pollutants that are emitted during the wildfire. One of the main important is the particulate matter, and this is showing the different size of the particulate matter, 10 to 0.5, which I will also talk in a second. And these particulate matters are made up of the different gases, the different components, organic and inorganic components. There are also the gases that are also emitted as well, such as nitrogen oxides, ozone, and volatile organic compounds. And these gases, such as volatile organic compounds and ozone, can also play a role again in the formation of the particles. And depending on the chemical composition of the particle, that can have an adverse effect on the environment and human health as well. This is showing the oxidative stress that is induced from the wildfire smoke, that shows the damage in the airway epithelial cells, like free radical species, when they are induced due to the emission of the wildfire smoke, and when we inhale that cause, and that can cause the damage in our epithelial cells, and that leads to injuries in our body, causing an inflammatory response, causing the increase interleukin species, and then leading to different diseases. If you're interested, you can see this in the paper Rijo and Rijo that's published. Canadian wildfire that occurred, as I showed you in a graph, that they had the largest land area that had gone through the wildfire. And so we saw for several days, especially for one day, that there was really bad, and then millions of the US population is affected. That caused us several air quality alert, and even lead to a school closure. And this I'm showing in the the Wednesday of the June 7th in the 2023, which saw a smoky haze, which everyone was able to not only see, they were able to even smell the smoky kind of thing that actually traveled all the way from the Canada. And as I mentioned, one of the main component that is emitted from the wildfire is the particulate matter. And you may have seen this figure. And the particulate matter are usually classified based on size. And usually they are studied for the PM10 and 2.5. And 2.5 is the one that is smaller than 2.5 micrometer in diameter. 10 is the one that is smaller than 10 micrometer in diameter. And this is shown in comparison to the size of the human hair and the fine beach sand. They have both natural and anthropogenic sources. The PM and wildfire is one of the main source of the particulate matter, and they have environmental and health impacts such as asthma, respiratory disease, heart, and cardiovascular health as well. So we measured the particulate matter at the 4-story roof of the one of the building in Villanova, near the one major intersection near the entrance of the Villanova University. And this is the picture of the roof, and that is taken during that day when we see such a hazy atmosphere in the sky. We measured two main components, the particulate matter and the black carbon, PM 2.5, and we measured 3 different instruments to measure the PM 2.5, the dust track instrument, dust track DRX aerosol monitor, and the e-sampler, which measures in a 5-minute interval, and the dust track was measuring in a 10-second interval. We also collected the particles in the filter paper for the further analysis of the chemical composition, and we also measured the PM 2.5 by using gravimetric method, sort of more like a quality check as well. And we also downloaded the data of the PM 2.5 from the US EPA's monitoring station, which has been monitoring the PM 2.5 from the 1986. One of the main component of the smoke, as we know, is the black carbon, the soot that comes from it. So we also measured the black carbon on the 10-second intervals, and we measured on the 5 different wavelengths. So now I'll be showing you some results. So we measured this for mainly for the first week of the June, but we also this instrument e-sampler, we kept it for like about 2 months, and you can see the peak that it's having, the 5-minute interval, and we also average it for the 24-hour average. And you can see that the PM 2.5 was average increased during the 6th, 7th. And in this case, we are also seeing actually the high concentration at the end of June and also in the July. So there is not only the one particular episode that was occurring, which I'm going to focus mainly in the first week of the June, but it was also occurring even after that. Even we were not able to see such a worse condition as in June 7th, but it was also occurring even after that. So this is from the one instrument e-sampler. All of them were measuring the same thing. The dust track, I had placed the 2 dust track at the different locations on the roof. And then one of the instrument, the dust track 2, which is the blue color, that actually shows that the PM 2.5 increased really greatly. As we can see on the June 2nd, the PM 2.5 concentration was less than 10 microgram per cubic meter. And by the time when it reached in the June 7th, it actually peaked in certain periods up to like close to 1,000 microgram per cubic meter, showing the huge impact of the transport of the particulate matter from the Canadian wildfire and in the Villanova, because this measurement was done in the Villanova campus. This is the measurement that is taken by the Philadelphia's 6 monitoring stations. So I downloaded the data from all 6 monitoring stations. This actually signifies the ID of this monitoring station. And we can clearly see that mostly it doesn't increase greater than 40 microgram per cubic meter, it looks like, throughout the year. But during these wildfire smoke episode, and these are the daily measurements. So these are the 24-hour average measurement from that, and we see that it picked up to like about 240. So for the PM 2.5, the 1 year's average standard by the EPA, National Ambient Air Quality Standard, is a 35 microgram per cubic meter, and for 1 year average, it says that it should not exceed more than 9 microgram per cubic meter. And for both these criteria, we can see that it clearly exceeded by several times during the episodes of the transport of the wildfire in Philadelphia region. And I zoomed in for only the June and July in this region, and we can clearly see these two different dates when there was a very high level of the PM 2.5 recorded at the Philadelphia monitoring station, which impacted the city and the suburban region. Everyone was untouched from this transport of the air pollution. This is the diurnal, so I also plotted. This is from the Villanova instrument, and we see that on average, I average it all over from the entire week, from June 2 to 6. Please remember that the one peak that occurred is actually in June 7th. So I looked at the diurnal concentration of, means that daily, hourly variation of the PM 2.5 before the smoke traveled, the large peak that traveled, and after that actually it occurred. So we see a little bit different pattern of this in the time when it was occurring. There seems to be some kind of nighttime peak, and then the morning peak, morning increase in the PM 2.5 and nighttime peak. But when we had that increase, we can see there is actually the large amount that is occurring in the early hour and 7 a.m. In terms of the black carbon measurement, the black carbon can be measured in different wavelengths, and the UVBC, the yellowish color is the one that is known as actually a marker of the wildfire smoke. And we see that this is the one that is shown as the high concentration. And just like for the PM 2.5, when we had the wildfire smoke, then we saw the large amount of the black carbon that has traveled to our region. Again, to let you know, black carbon is known as the marker of the primary emissions, or the one. The black carbon is emitted mainly by the combustion. So it's mainly from something that is burning. So this is really showing, again, the impact of the smoke that is coming. So it's increased by at least 10-fold compared to the day when we see the we suspect the less impact of the wildfire smoke, sort of like the baseline. And overall, when I compared with the PM 2.5 measurement by the three different measurement, gravimetric instrument and the dust track and the e-sampler, it looks like dust track tends to somehow overestimate the PM 2.5 measurement, whereas e-sampler seems to underestimate for the June 5 to 6, whereas it's very similar to 8 to 9 compared to the gravimetric measurement. Gravimetric can measure only for the daily period, so we are showing only the 24-hour average comparison with the gravimetric method, which is done by weighing the particles that are collected on the filter paper. So this shows as a quality check for our three different measurement method. So overall, we see that the great impact of the cross-border transport of the wildfire smoke that's been transported from the Canada region, and PM 2.5 and black carbon are the one that show the greatest increase, and these are the one that has a several adverse health impacts, and that affect the large population in the northeastern region. We saw the daily mean of the PM 2.5 increase by about 13 times, while the it increased over 100 times during the peak period, as we saw, like it's reaching even up to like close to 1,000 microgram per cubic meter with the one that is measured by the dust track instrument. So Canadian wildfires are still continuing to impact our region, as recent as 3 weeks ago in Philadelphia region. And so continuous monitoring of the air quality so that we can give out the air quality alert and be also ourselves more conscious of the air quality label so that we can prevent from exposure to such high level of air pollution during these periods, and minimizing the outdoor activities are very important. So thank you. I would like to acknowledge the NIH. Through this grant, we're actually measuring the air pollution on the roof during that time. Also, want to appreciate the support from the Department of Geography and Environment at Villanova University, and the two undergrad students, Brent Jenkins and Arunjit Tian, and a grad student, Anjum Karim, who also helped for the measurement of this. If you have any questions, please do not hesitate to shoot out an email to me. Thank you so much.
I would like to acknowledge Adrian Wood, who edited and produced the webinars, and all of the webinar organizers shown on this slide, who curated webinars on a variety of climate change and health topics. We invite you to follow this QR code to the College of Physicians YouTube page, where you can access the webinar series. The QR code on the bottom right will take you to the section on public health and preventive medicine. We hope you will consider joining this section to learn more about public health and activities to improve it in the Philadelphia region. Thank you for your interest in our webinar series on climate change and health in Philadelphia.